All right, good morning. I'm Dr. Zoe McMillen, and I'm here with a couple of people. We're all practicing physical distancing. We're here at Lifescape Premier. We had a few technical difficulties with the feed, so if you're just joining us now, we haven't missed anything. We're kind of just doing a little bit of a redo here. One of the new things that we're getting used to in this new society that we have to live in. Today, we're really going to focus on what patients who have had COVID-19, what they say, their experiences, and their suffering. One of my patients who would like to remain anonymous, and we are doing that, has spent a significant amount of time generously writing out answers, and Bob Wilder is going to read those answers for us, and I'm going to be asking the questions that we posed to him. We also took some of your questions that we have asked him to reply to. Just a little background about my patient. He is relatively healthy, 46-year-old male. He had no significant health conditions, no comorbidities, nothing like that. I first met him virtually on the 25th of March, and he was already 11 days in to his illness. He had a pretty moderate to severe course of COVID-19. He ended up requiring multiple hospitalizations, including a short ICU stay, but thankfully he never needed to be intubated. We communicated daily, multiple times a day via text, calling, email, and I started to see patterns of when he would start feeling worse and really get to know him. Could definitely tell night times were more of a struggle. That's when his symptoms were the most severe. From his standpoint, he has shared multiple times that he really appreciated having somebody to be able to talk through what he was going through, what he should do. We had a lot of discussions of, okay, is this the point we go to the hospital? What do we do here? And I think from a patient's perspective, one of the biggest challenges is that feeling of isolation, and that you're on this in this by yourself. But that's not true, and we want patients to be able to reach out to their doctor and be able to have that relationship where we can be there with you through the journey. It was clear from the beginning that this virus is new, and I said to my patient, I'm not an expert, nobody is an expert, but we're going to work through it together. I'm going to stay up to date on the latest evidence of treatment and what we should be doing. All right, so now kind of jumping straight into some of the questions that we posed to my patient. Here we go. And once again, remember, Bob Wilder is going to be helping to read the answers he provided. Okay, what would you say to those who think this is overblown, or that we should allow it to run through the community, protecting only the elderly?
Initially, I believed that the virus was not a threat to me personally. I was reading about the elderly and those with underlying medical conditions having complications from the virus. But that wasn't me. I'm 46 and in good health. I figured the worst case, I have a cold or flu-like illness, maybe a slight pneumonia, and I'll recover just as I have from every other respiratory virus I've contracted in my life. I was infected by the virus while on a one-week trip to New York City in early March. My initial thoughts on the virus could not have been more wrong. I ended up in the ICU coughing up blood with lungs that could not properly oxygenate my blood, and spent a total of a week in 2 different hospitals. I started to research the virus while recovering in the hospital. What the heck infected me? What I read, the stories I heard, were describing a new, unknown virus that was not relatable to any other virus I was familiar with. My initial thoughts of, it will be like having a cold or flu, were naive. It now appears the virus dries out the lungs' natural lubricants, causing portions of the lungs to collapse and stick to themselves, unable to open and accept breath. Besides the organ damage from not receiving enough oxygen from dried out lungs, it appears this virus directly attacks your vital organs and causes body-wide blood clots that can further damage your lungs and harm your organs and brain. And the mucus. One of my major complaints in the emergency room was just how much mucus my body kept producing. I felt powerless to stop my lungs from filling up with mucus. This virus is an unknown to humanity. Experts don't even know how to treat it properly. Studies are now showing that putting patients on ventilators and treating them with hydroxychloroquine might actually be doing more harm than good. Months after this virus started spreading, we are all still learning. It is nothing like a common cold or flu virus. Even though the virus hit me hard, my 19-year-old son, who is now showing positive results for COVID-19 antibodies, did not have any symptoms. My partner had a low-grade fever for a couple of days, and that was it. No respiratory symptoms at all. Recent antibody studies in New York City and Los Angeles suggest that a very small percentage of infected patients ever have any symptoms. Back to the question. I do not think the severity of the virus has been overblown at all. Everyone should be practicing social distancing, wearing masks, washing their hands, and limiting their physical interactions with other people. I don't think I'm qualified to answer whether we, as a society, should remain open and let the virus run its course. I don't think we have enough data on the actual mortality rate, which is looking to be close in unvaccinated flu patients. Nor do we have enough data on increased physical and mental suffering and mortality due to an economic downturn. Economic depressions kill people too, and have lasting quality of life issues that can last a decade or more and dramatically affect children's life trajectories. It is a very complicated question for which I don't have an answer.
All right, and second question, what were the greatest challenges going through this ordeal?
Watching my lung function decrease each day and being admitted to the ICU, I knew the next step was ventilation if I continued to deteriorate. Recent studies are showing that only 1 or 2 out of 10 COVID-19 patients make it off the ventilators alive. I had no idea how I would fare, but I figured I would survive. But 15% of those in my age group do not when admitted to the hospital. My greatest challenge during my infection was managing my emotions, of talking to my son and partner regarding how they should continue in case I don't. Here is where you can find the trust documents. Here's the contact information of the CPA and trust attorney you can trust. Here's my medical power of attorney. These should not be conversations you have with your 19-year-old son. What lasting effects will all this stress have on my son over time? Challenging, to say the least.
And just to touch on that, absolutely horrific thinking about having to, do that, and at a time when most of us couldn't imagine at age 46 needing to tell someone about the trust and the will and medical power of attorney. But it kind of does drive home the point that we probably should all have an advance directive, and that is something that we can help with. There are certain websites, organizations who can help with this. Dr. Weld actually even told me about one that I looked at and was pretty impressed with, called Join Cake. So it behooves all of us to have that in place, because no one wants to think about it, but rather have that than the alternative if something happens, and it could be even getting hit by a bus, that kind of scenario, and then you don't have those things in place. Okay, getting to the next question. As someone who was relatively young and healthy prior to and getting hit with COVID, did you feel blindsided?
Absolutely. My first symptom was a dry cough, and I really didn't expect much else. 104 plus fevers, coughing up blood, failing lungs, and ending up in the ICU was a complete shock and wholly unexpected.
Okay, we often find people tend to neglect their health until it fails. How has this experience changed your concept of stewardship for your health?
I think I'm a lot more cognizant of my health now and how it will carry me into old age. I required 24/7 supplemental oxygen after being discharged from the hospital. I needed oxygen to walk, to sleep, to do anything really. I could only walk about 1/3 my normal pace with oxygen bottle in tow. I felt like a 95-year-old man with emphysema from smoking 2 packs of unfiltered cigarettes each day for the last 70 years. I don't ever want to feel like that again. I want to enter old age with my body working as well as possible.
Any words of advice to others facing this disease?
Don't get it in the first place. Take your protective measures seriously. I still see people in public with no mask, touching their face, no hand sanitation, and getting super close to other people. I guess I was just like them in early March, riding the subway in New York City. Now, after experiencing this virus, I know my behavior was naive and foolish. Studies show infected people are most contagious before they show symptoms, and most people don't show any symptoms at all. You can't just try to avoid the sick, coughing people. You have to assume everyone is infected, because the person that will infect you most likely will seem healthy and uninfected.
What symptoms did you have that made you not want to take the hydroxychloroquine?
It is hard to put in words. I did not have any one particular symptom that stood out. It just felt like I was being poisoned, just a general malaise, a sense of general unwell. I always felt better off the hydroxychloroquine than on it. The feeling was intense enough to factor into my decision to switch hospitals mid-treatment. Today, I'm thankful that I listened to my internal voice to reject the hydroxychloroquine treatment.
And then we have some questions from one of our patients, and some of these, or a couple of them. What were your unique symptoms?
Everyone talks about losing their sense of smell and taste. This happened to my partner in a textbook fashion. For me, I always had my sense of taste and smell, but the inputs were completely scrambled. Nothing smelled or tasted normal. I lived in a world of new, pungent, aggressive odors and taste. The worst offenders were toothpaste and hand soap. Horrible, horrible smell those two products had. I'll never forget it.
When was the onset of your symptoms?
I was infected sometime during the week of March 9 and developed a dry, tickling cough on March 15th.
When your symptoms first started, did you feel or think that the symptoms were different than the common cold or a flu?
Yes, I never developed a viral infection, with the first symptom being a super dry, tickling cough. That is the symptom I usually end with, not start with, when infected with a respiratory virus. I knew immediately it was COVID-19, as it was on everyone's mind in New York City at the time.
How long did you feel unwell?
It has been almost 6 weeks, and I'm still not 100%. I was able to take a walk at a normal pace without oxygen 2 days ago for the first time. The worst of it lasted 2 weeks, with high fevers and dangerous oxygen levels.
When you emerged from the illness, how did you feel on day one?
Night 4 or 5 in the hospital, I realized that I wasn't getting any worse. Barring a deadly blood clot or blood infection, I knew that I wasn't going to die. I cried tears of joy for probably an hour. I knew I had a beat. It is hard to define a day one, as I'm getting better very, very slowly. I have milestones like sleeping a night without supplemental oxygen or taking a walk without oxygen. That gives me a good boost and lets me know that I'm improving.
And are there any silver linings, any positives to this experience?
Not a lot of silver linings that I can think of, but a great question that I need to spend more time contemplating. The hospital stays have left me with a slight touch of PTSD, and I think that it is still too early in my mental health recovery to reflect in a balanced, meaningful way. I do know that the next pandemic will not take me out. I will be prepared with all the personal protective equipment that I'll need to avoid infection in the first place. So, I guess this round has made me more prepared for the next to fend off a deadlier pandemic. I won't be running out of toilet paper, that's for sure.
All right, and those are all the answers that my patient had answered. Really appreciate his time and effort helping everybody to see his journey and experience. And once again, to recap, not everybody's going to have his experience. There's great variability. We have people who are asymptomatic, who don't even know that they're sick, and they of course can spread it easily because they think they're healthy. We have people who are pre-symptomatic who are spreading COVID, so they aren't even aware yet that they have it, but they will then develop symptoms a little later. That's the pre-symptomatic. And then we have symptomatic, where you can have a mild course, and mild does not mean nice, Mild could still be high fever, shortness of breath, cough, headache, body aches for many weeks. Moderate, which is then, everything up to some hospitalization stays, needing oxygen, needing additional therapies. And then severe, of course, is the worst case where someone could land up in the ICU intubated. We are all, I think, living in this very unprecedented time where our lives are changed. I like to call it physical distancing, rather than social distancing, because I think we all need to still be very socially connected. We around the office are all wearing masks, practicing physical distancing. It's different. No more high fives, no hugging, no gatherings. There's a lot of emotional strain. People are worried about the financial aspect of this, health-wise. Stress is, very high for everybody, and there's a lot of anxiety. We're also mentally challenged because isolation is not normal for us as humans. We're a species that, thrives on social interaction. So this is a very different environment that we find ourselves in. From a provider perspective, I can tell you that there are times I was very stressed caring for my patient where I lay awake at night wondering, did I tell him the right thing? Are we doing the right thing? What else is going to happen next in this time where we don't know everything about this virus? That is very stressful. Trying to make sure I know the latest evidence, and is it a valid study, or was it, a study that wasn't done as well, and then I can't take the findings to be most likely true. So a lot of uncharted territory. I think we've got to be kind to ourselves and to each other, and we have to trust the experts as well. I would love my life to just return to normal and be seeing friends and family and everything, but I know that would not be right at this time, and I know it's frustrating. A lot of people are getting antsy and want things to just return to normal, and hopefully we can get to a different version of normal. It may not be the exact same, but maybe when we have this a little more under control, things will be better when we can have some social interaction where we just have a lot more physical distance and just certain things in place to make us all safer. We are strong, but that isn't to say this isn't challenging. And there is family stress. Children are not experiencing their normal routines. Parents are trying to work from home and take care of the kids and do homeschooling, which is incredibly difficult. Grandparents are feeling isolated. They separated from friends, families. High school and college graduates won't be able to walk and go through a proper graduation ceremony. These are all some life-defining events, and maybe in future generations, our children will say, remember that time when and there'll be a big story behind that. There's no sports. And I'm not really a huge NFL football fan, but oh my gosh, I was glued to the TV last night watching the NFL draft. I think we all craving some sense of normalcy in this time. I can even see in my daughter, who's 4.5 years old, she's had a little bit of behavior regression and now doesn't want to go sleep in her own bed at night and talks about, is this safe to touch? Is this washed? So I think everybody from young to old, we're all feeling this in different ways. I really encourage people to reach out to their physician if they're having any difficulties, both physical or emotional during this time. We are here for you. People mustn't neglect their physical needs and ailments either. I've been starting to read horrible stories of people not going to an emergency room when they have chest pain because they are scared of getting COVID, but then they end up passing away at home from a heart attack. So we still do encourage people to seek medical care. We want to help take care of you. We're trying to do things virtually if possible, but we are also here for you in the office if needed and practicing very safe ways of seeing patients, limiting the number of people in the office, a lot of sanitizing of the rooms, wearing masks, etc. So I just encourage you, reach out to your doctor if you're feeling that maybe there's a little more than just stress and sadness. about things changing, we need to know about that, because that's also a very important factor in your health and well-being. All right, and then I'm just going to ask Dana, who's our wonderful functional medicine nutritionist, and she is here for you and also doing a lot of virtual consults and helping our patients through this time and in optimizing their health. That's the best thing you can do, once again, is optimize your health, because that's right now the best way of preventing or fighting this disease, is to not have those comorbidities. I'm just going to ask her if we have any questions. Okay, we do have some questions. All right.
What ideas can you give people who are on the front lines to help their mood?
Oh, that's a really difficult one. I think depending exactly what front lines, I would say they're the healthcare front lines, and then they're also like working in the grocery store front lines, etc. I would say for the healthcare front lines, they're probably seeing a lot of very sad, disturbing events, things that we're not used to seeing. In an ICU situation, people do pass away daily from various conditions. Now people are seeing people pass away at a higher frequency, and maybe people who we previously thought shouldn't be passing away, so healthier, younger people. And so there is a challenge with that. I think looking after yourself would include meditation, taking time to decompress. For different people, that means a different thing. It can be exercise, it can be talking to a close friend, it can be talking to a therapist, different ways to handle that. Trying to connect with your normal life as well outside of work, I think, is important, to see that that is not the entire world that you are experiencing, even though it is such a devastating experience when you are there. For people on the front lines, be it in paramedics, or they're also getting a lot of the trauma because they're seeing a lot of people who are very sick and they have fear for contracting the disease themselves. They're seeing a lot of suffering as well. And then even grocery workers, they're trying their best to help us at this time, and they're worried that they're going to get it because they're exposed to a lot of people. It's difficult to physically distance when you're in a grocery store. So that was a good question.
Thank you so much for doing this each week. It's so helpful.
Well, we really are here for all of you. We're going through this with you, and we're trying to stay on top of the latest research and guidelines and help you in the best way we can. It is isolating to all be in our separate homes and separate places. That's why we'd like to reach out and stay socially connected. All right, well, thank you, and we will be doing this again next week. We'll put more details about that on the website. Appreciate you all. Please stay safe, stay healthy, and keep the physical distance. Thank you.